As more reports of yellow fever and cholera are being confirmed in the country, and this is making people worried. The federal government and the state governments have been trying their best to contain the spread of these diseases, and international organizations such as the WHO have been pitching in. To discuss more on this issue, we're being joined from our Abuja studios by Dr. Mary Stephen, the team lead of the World Health Organization's Health Emergencies Program. Thank you very much for joining us on the program.
Thank you, Melinda.
Now tell us, what is your organization doing to help to contain this disease?
Okay. The World Health Organization is supporting the government, both at the national and the state level in Borno State, to address the challenges with regards to cholera control happening right now in IDP camps. So the organization has been supporting the state government in the areas of surveillance, case management, laboratory diagnosis, risk communication, and currently also the ongoing oral cholera vaccine campaign in Borno State.
Now, what are the challenges your organization is faced with in carrying out this task?
Well, the main challenge, I think, would be in areas of security compromised areas where you have difficulty in accessing those areas. But with the measures that the government has put in place, those populations have been reached also with the vaccination campaign and other control measures.
You mentioned Borno State. What about Kwara State? There's a case of yellow fever there.
Yes, so in Kwara State, there is one single confirmed case of yellow fever. Currently, the government, the Nigeria Center for Disease Control, and the World Health Organization has deployed a team to the field to do more assessment of the situation and also to do risk assessment to determine the target population. So after the risk assessment, there is going to be a reactive vaccination campaign in Kwara State as well.
Would the vaccines deployed be enough?
Yeah, right now the Nigerian government has some stock of yellow fever vaccine already in country, and we also have the opportunity of applying to the ICG for additional vaccine. But currently, as the risk assessment is ongoing, the current vaccine stock, both in country and globally, it's going to be enough to address the challenges in Kwara State.
Now, Dr. Stephen, tell us, has there been any case of a patient not responding to treatment?
So in terms of the cholera response, no. Cholera is a known disease. Control measures are also known. So basically, what happens is usually early detection of cases. But in most cases, patients that are infected may not present with symptoms. And where they present with symptoms, a lot of them present with mild symptoms. And that you can manage with oral rehydration. And in severe cases where you have patients that require admission, patients are admitted, and mainly because it's a diarrheal disease, dehydrating disease, you admit patients and manage by replacing fluid, replacing electrolytes as well. So control measures, especially in terms of treatment for cholera, is well known. And of course, all the patients that are responding, that are currently being managed are responding to treatment. So where you have complications, maybe in a situation where the patient is delayed, they stayed at home, maybe started doing some measures at home, and then came to the hospital at late stage. But as soon as the case is dictated and reported to the hospitals, it's treatable.
What about yellow fever? It is said that there is no cure.
Okay, so for yellow fever is a viral disease. It's true that there is no specific treatment, but mainly also like the cholera the cholera symptoms. Yellow fever presents with mild symptoms in most people. Where you have severe cases, treatment is usually symptomatic. So you treat the symptoms that the patient is presenting with. And currently the situation we have in Nigeria, the first case that is confirmed, it has recovered even completely. So it's a mild disease that the patient has presented with and has since recovered and is discharged from the hospital. So treatment, like we said, once you detect early, commence early treatment in terms of addressing the symptoms, and then the patient will be fine.
So tell us more about these treatments. What are the treatments available?
Okay, so for yellow fever, like I said, it's symptomatic treatment. If the patient is fever, you give antipyretic. If the patient requires fluid, you give fluid. So it depends on what kind. If vomiting, you give medicine to address that. So it depends on the kind of symptoms that the patient is presenting with. So basically, you treat the symptoms that the patient is presenting with. In case of cholera, it's usually a dehydrating disease. So the main treatment is ensuring that you replace the fluid that is being lost. And in terms of electrolyte imbalance, where you have severe disease, then you replace the lost electrolyte as well. Then as part of control measures, especially for yellow fever, there is an effective vaccine also that confers lifetime immunity. So the vaccine has been introduced in Nigeria. It's in routine immunization, and it's given to children at the age of 9 months. So as soon as one dose is taken, it confers lifetime immunity. So it gives immunity against yellow fever infection in the future. Adults can also take the vaccine, and it provides lifetime immunity.
Many thanks. Dr. Mary Stephen is the team lead for the World Health Organization Health Emergencies Program in Nigeria, and she's been speaking with us from our Abuja studios.